In this video, we want to cover SumaTriptan. This is a anti-migraine drug. It is called as a triptan, okay? SumaTriptan. It is an anti-migraine drug, so for headache, right? The first line of drug for patients who fail to respond to analgesics, you will give SumaTriptan. So if a person has migraine and analgesics are not helping, then you will give SumaTriptan. Just note that it is a 5-HT receptor agonist, okay? Now, I will go into details of that. First of all, what is 5-HT? 5-HT is also called as serotonin. It is a neurotransmitter, fine? Mainly what it will do, it will constrict large arteries, fine? Now, for this serotonin, that is 5-HT, that is 5-hydroxytryptamine, there are 4 types of receptors, okay? 4 families of receptors are there. 5-HT1, 5-HT2, 5-HT3, 5-HT4 to 7. Some families are there. But here we are concerned about what? Only 5-HT1. Because that is what our SumaTriptan works on. Okay. Now, moving on to 5-HT1 receptor. These inhibit the serotonergic neural activity in brain. Actually, they inhibit the neural activity in brain. Now, in this 5-HT1, there are subtypes, you should know. 1A, 1B, 1D, 1E, 1F. Fine. Now, 1A, you should know. 1D/1B, you should know. Because the SumaTriptan works on this. That is why, right? It's already written here. SumaTriptan, that is our anti-migraine drug, works on 5-HT 1D/1B. Now, what is this 1D/1B? No need to break your head. 1D is what it is called in humans and 1B it is called in rats. So, this receptor it is going to work on. Now, SumaTriptan is going to work on this receptor. It is this receptor agonist. Okay, it is an agonist to this receptor and hence it constricts cranial blood vessels as serotonin does. Similarly, it will constrict cranial blood vessels and also it will inhibit the release of some inflammatory materials if they are there. It inhibits the release of inflammatory materials, okay? So, as it constricts the cranial blood vessels, there will be little less blood flow to the brain and the throbbing headache will not be there. That's all. So, migraine is treated. Now, coming to SumaTriptan. SumaTriptan, I already told you it is a 5H1D or some people write as 5HT 1D/1B receptor agonist. It activates 5-HT1 at higher concentrations. It constricts cranial blood vessel. Got it right? This we have already told you many times. Moving on. SumaTriptan for migraine. For migraine, how does SumaTriptan help? How should you give it? We already told you it will constrict cranial blood vessels. So, it will help in reducing migraine. And also, it will reduce the inflammatory substances. Okay. Now, coming to SumaTriptan for migraine. How will you administer? You will administer at the onset of attack. Basically, you have already checked that analgesics are not working, right? So, only for acute attack or moderate to severe attacks, acute attacks of moderate to severe migraine, which are not responding to analgesics, to that you will administer SumaTriptan. Clear, right? Take a break. Take a deep breath. Try to understand. It's very easy. But if a person has moderate to severe migraine only, which is not responding to analgesics, then only you will administer SumaTriptan at the onset of attack. Okay. How will you give? You can give a tablet, you can give nasal spray, you can give subcutaneous injection. Based on the mode route you are giving, you can choose the dose. Tablet means 50 mg because oral bioavailability you have to think about. Nasal spray, you can give 25 mg enough. Subcutaneous injection is you will give even more less, 6 mg per 0.5 ml. Okay. The patient will get relief within 2 hours. However, migraine can reoccur after 24 hours. Migraine can reoccur. Is this clear? Shall we move on? You want to take a break? Take a break. Now let's move on. SumaTriptan versus Ergotamine. See, let us try to compare these two, okay? Actually, I would say Ergotamine, okay. See, SumaTriptan is more effective, okay, than Ergotamine. This much you should know. SumaTriptan wins the game here. SumaTriptan is better. Ergotamine actually increases nausea, vomiting, so people don't like it. SumaTriptan and Ergotamine should not be administered within 24 hours of each other. You should not administer them within 24 hours of each other. Okay. Ergotamine, how it works? It works as a partial agonist and antagonist. However, SumaTriptan is an agonist, right? You have already seen that in the previous slides. Moving on. SumaTriptan's mechanism of action. How do these work? We have already told you, constriction of dilated cranial blood vessels, and they also inhibit new inflammatory substances, the release of inflammatory substances. Also, some inhibit extravasation of plasma proteins, etc. are there. If you can remember. The carotid artery expresses these receptors. These are the receptors on which it acts, right? The carotid artery has these receptors which our SumaTriptan wants. SumaTriptan's adverse effects. Now we are moving on to the adverse effects. Tightness in head and chest. So please think what will happen if it is generally not, it is kind of safe, okay, not many side effects are there. Not many side effects. Not that bad it is. However, tightness of head and chest you can say. Contraindications. SumaTriptan, you should not give it if there is ischemic heart disease, because obviously it is constricting blood vessels, the major blood vessels it is constricting. So you should not give if there is ischemic heart disease, if there is hypertension, because it will increase the blood pressure further. Pregnancy you should not give, and main thing is person should not drive. If you are giving it to a person who is driving, it wouldn't be good. You are going to constrict his blood vessels. So, okay. Now coming to something even better, Rizatriptan they say is even better than SumaTriptan. It is a similar drug and it is more potent, higher oral bioavailability is there, and it is faster in onset of action. So why would you choose a SumaTriptan? Summary. Let's look at summary now. Let's go back and start from the beginning. SumaTriptan, it is an anti-migraine drug. It's the first line of drug for patients who fail to respond to analgesics. Overall, if you have to say, it is a 5-HT 1D 1B receptor agonist. Just to give a brief about what 5-HT is, it is serotonin, it's a neurotransmitter. Basically, it helps in constriction of large arteries and veins. Large arteries and veins are characteristically constricted. 5-HT2 receptors, there are 4 families here, not required for you. Moving on. 5-HT1 receptor, mainly under 5-HT1 you have so many categories. We are concerned mainly about 5-HT 1D/1B. SumaTriptan is a 5-HT 1D/1B receptor agonist. Hence, it works similar to serotonin. It will constrict blood vessels, cranial blood vessel in this case, and even on the carotid artery. It activates 5-HT1 at higher concentrations. For migraine, you should give it at the onset of attack only if it is an acute attack with of moderate or severe migraine. And if the person is not responding to analgesics or their combinations, then you can give SumaTriptan. You can give it by tablet or nasal spray or subcutaneous injection. Relief will be, the person will get relief within 2 hours. However, migraine can reoccur after 24 hours. So, migraine will reoccur. That time we will again give it, right? What say? SumaTriptan is more effective than Ergotamine. It is more well tolerated than Ergotamine. And Ergotamine actually increases nausea, vomiting. So, we really don't want Ergotamine. SumaTriptan and Ergotamine should not be administered within 24 hours of each other. Ergotamine is actually a partial agonist and antagonist. However, SumaTriptan is an agonist of 5-HT receptors. Mechanism of action, same thing. Carotid artery expresses these receptors on which SumaTriptan is going to work as an agonist. It is going to constrict the dilated blood vessels. It is going to inhibit the release of inflammatory substances. It is also going to inhibit the extravasation of plasma proteins. Adverse effects, not many adverse effects are there. It is well tolerated. However, there could be tightness in head and chest. SumaTriptan's contraindication: don't give it to a person who has ischemic heart disease, hypertension, pregnancy, and the person should not drive. Coming to the improved version of SumaTriptan, it's called as Rizatriptan, and this is a similar drug. It is more potent, it has higher oral bioavailability, and it has faster onset of action. Why not use it, right? Summary. So we are done. If you want to tell me what you learnt in this, it will be a good time. SumaTriptan. We learnt about SumaTriptan. We know that it is an anti-migraine drug, first choice in case analgesics don't work. It works on 5-HT 1D/1B receptor agonist is. What else did you learn in this video? What else? Anti-migraine drug. Then it is better than ergotamine. Better than ergotamine. However, Rizatriptan is better than SumaTriptan. Is it Rizatriptan? Yes, Rizatriptan is better. What else did you learn? Adverse effect: tightness in head, contraindications: ischemic heart disease, hypertension, pregnancy, person should not drive. Should not drive you have also seen in other things, right? Benzodiazepines. What else did we learn? Constriction of blood vessel is the method of action, mechanism of action. You can give it by tablet, nasal spray, or subcutaneous injection. Fine, that's all. I think we have covered everything. Okay.